Do you see a lot of misdiagnosis with ADHD or with any other mental health conditions?
Yeah, so, well, in fact, one of the diagnostic criterion in an ADHD assessment is this cluster of symptoms cannot be better explained by any other condition.
Okay.
And that's why, from my personal point of view, I'm probably going to get lots of comments about this, I do think a trained psychiatrist should be doing these diagnostic assessments. You see, if you don't tease out the symptoms properly, either you will miss ADHD or you will actually misdiagnose someone and say they've got ADHD when they might have something completely different. And that can be very dangerous, and I'll explain why. We'll probably talk more about the treatment of ADHD, but one of the treatment options of ADHD is something called stimulant medication. If you prescribe stimulant medication to someone that has bipolar disorder, they are at 10 times the increased risk of having a manic episode.
Okay.
You've given them the wrong medication. Right?
Yeah.
Secondly, if they have, for example, any underlying psychotic symptoms which you didn't pick up because you didn't ask for them, you will very highly likely push them into a psychotic episode.
Okay.
So
this part of the assessment is really important.
Very important.
Yeah.
Very important. And it really needs to be done, in my opinion, by a trained psychiatrist.
Yeah. What other professionals then can diagnose at the minute?
Well, at the moment, psychologists are diagnosing in certain clinics, nurse practitioners, etc. If someone is very highly trained in this area, or maybe they're supervised with a sort of consultant psychiatrist, it might still work.
Yeah.
But I do think you really need to have that general psychiatric knowledge of how other conditions can present.
Yeah. And also understanding how medications also work and how that, or what impact that has on the brain as well.
Yeah. I mean, there's that phrase, what is it? The man with a hammer only sees nails, right?
Yeah.
That's very much true. If you just do this type of work, which is fine, you can start to see ADHD everywhere. And if it's something else and you go on and start treatment, you might make things worse.
Yeah.
That being said, ADHD treatment for ADHD is by far the most effective psychotropic medication there is out there. Full stop.
Yeah.
But you must make sure that you're treating the right thing.